nobody's shown that there is a clinical difference. So the benefit of the mix is that with the cortical particles, you'll get a more stable clot and less chance that you're going to get some shrinkage. The straight mineralized will heal faster because it'll turn over faster and create the patient's own bone and vital bone. But the cortical particles will help kind of hold the space. If you have a single socket with no defects, 4 walls all intact, ideally what I would use is a straight mineralized cancellous because it will create a nice stable clot. It'll absorb blood. It'll turn over quickly. In those situations, certainly right at 3 months, I'd go back and place the implant. You can also use cortical cancellous in that area. I might give it a little bit more time healing if you're using a cortical cancellous, but it certainly is appropriate as well. If you've got some defects on the buccal wall and you're concerned about really kind of building out that buccal wall, that's a place where I would use the cortical cancellous because those cortical particles, again, will resorb slower and help to hold that space well. If you have multiple sockets against each other, so the potential for the interproximal bone to resorb is greater than if you're grafting against a tooth. If a tooth is there in the adjacent space, the height of the interproximal bone will generally be very stable. So if you're doing 2 extractions next to each other, the interproximal bone height is not as stable. And so that's a place where I would use the cortical cancellous as well to help to maintain that bone height as much as possible. In a sinus, you can pretty much use either mineralized cancellous or cortical cancellous. Both have been shown to work equally well. And again, the important part is using a material where you get a really high vital bone content because that's where you want good bone vitality to, again, heal around your implant. So let's say in an area where you've got a defect and you're going to do a bridge. Tooth came out, you're going to do a bridge there. Again, you don't want that area to become a big convexity where the pontic has got to drop into that space. So that's an area where I potentially would use a complete cortical material. And the cortical, again, is dense particles that will resorb very slowly. And that's perfect for a pontic space because you want that space to really resorb slowly. It would resorb too slowly, in my opinion, for placing an implant there. But for a pontic space, that would be an ideal material. And when you're talking about all on X kind of materials, all on 4, all on 6, all on 8, again, a lot of times you are removing, some bone, but there's still going to be some defects, and you don't really want a roller coaster kind of anatomy. So where there are defects, it's good to fill that in, and a cortical cancellous is a good material for that.